everyone. Good evening. I will wait till this gets connected to you all, you guys. I hope you had a wonderful week and I hope you have a great plans for the weekend. Thank you everyone for joining. We'll just wait for 2 minutes before we connect to the very special guest today that you all have been waiting for. Yes, today we have an incredible guest on our show, Dr. Terry Wahls, and I'm really excited to speak to her, and I'm sure you guys are waiting to speak to her as well. So, okay, I'm gonna invite. She is a person who needs no introduction. She is an inspiration to the MS community already, and we all look up to when it comes to multiple sclerosis. Good morning, doctor.
Hey, good morning. How are you?
I'm good. Thank you so much. It's such an honor to have you here with us.
Oh, I'm thrilled to help spread the message that there is so much that we can do.
Absolutely. In your introduction, I just said that you are one person who does not need any introduction. We already look up to you for inspiration, for strength, for guidance, and for so much more. So thank you very much for doing the work that you are doing. You
Thank
are really incredible, and we all praise and love you so much.
you. know, and it's hard being out here doing this very innovative work because in the research world, the people who do something for the first time are often ostracized, ridiculed, rejected, and there is so much doubting and resistance that we have to overcome. But fortunately, I've been able to let the criticisms roll off my back and keep doing the work.
Absolutely. That's what we say, just do the work that you think is right. Even if with your good work, even one person's life is uplifted and improved, that is all. Every single drop in the ocean counts. And right now, what we are talking is not about the drops. You have already scattered your, positive vibes around the world in the entire ocean. So it's not about the drops that we have to talk about here.
We are, I'm so grateful because in 2007, the future I was facing was so incredibly grim. Bedridden, demented, intractable pain due to trigeminal neuralgia. And I've been so blessed that by the hard work that I did with reading the basic science, I was able to create a protocol that not only stopped my worsening, but to my amazement, my family's amazement, and my neurologist's amazement, reversed much of the damage and allowed me to get much of my life entirely back. And though my hair is grayer, my physicians say, like, oh my God, you keep looking younger and younger. Although, I sure I will start aging again, and so I won't get younger than my children.
Oh, no, you are still sweet 16. That's what we have to keep.
Very, very sweet.
Absolutely. So, doctor, we already, have read about your story. We have seen so many videos and your interviews and the entire world and all the audience watching you here right now. We all already know who you are and we have been waiting to hear from you. But, right now, my first question to you would be not just about your story, since we already know it. We want to know a bit of your experience, like which was one of the most scary moments of your life when you were dealing with this.
So as my trigeminal neuralgia was relentlessly worse, in 2007, it was very difficult to turn off. I was on maximum dose of gabapentin. I was taking visits to the pain clinic for injection. I was taking IV Medrol for 5 days when these episodes would turn on. And so my fear was that it would turn permanently on. We wouldn't be able to turn it off. And because when it was on, a breeze would trigger the pain, light, sound, the of my children, speaking, swallowing. And so it was hard to imagine what life would be like if that was permanently on.
Absolutely. I'm sorry you had to deal with so much, but the good thing is that we are seeing you finally smiling here. So, doctor, what was the most triggering point in your life when you said, "Yes, I need to do something. I really need to go out there against the medical uh,
Yeah,
institution and do something myself."
when I hit the tilt recline wheelchair, despite taking the latest drugs, including Tysabri, by the way,
Mm-hmm.
I realized it's up to me to do. Am I doing everything that I possibly can? I had two very young children. I had my wife, and so that's when I started going back to reading the basic science, and I began to experiment on myself. So it was getting in the tilt recline wheelchair and getting to the point where it was difficult to sit up.
It was difficult to sit, and you could not stand, and you were wheelchair bound. How difficult it
Yeah.
must. So, doctor, what do you believe in the power of determination, and how can that change one's life?
Well, I think I think about it in terms of my locus of control. There are always things that I can do, and the big question is, am I doing what is still under my control? So at that point, what my control is, I can still read and learn about what were the other potential studies that I could use to inspire a experiment on myself.
Okay, so you were a guinea pig for your own self, and
And
you
and I still
everything
am.
on yourself.
Science, I still keep tinkering on myself, and I plan on living to 120. So I'm going to do it for another 60 years.
Oh, yay! I'm sure you lived till 200. What's 120? And you were still 16.
Yes.
We have to remember that. So, doctor, so if we have to ask you, since we've seen you have done so much work and now we have the Wahls Protocol. So, if you just can give us a little brief about what's the Wahls Protocol, and can everyone dealing with MS benefit with it, or is it customized from person to
Right.
person as well?
So everyone who has a autoimmune condition will benefit from the Wahls Protocol, and it's much more than diet. It is a nutrient-dense diet that takes out the most inflammatory foods. It adds a meditative self-care routine, an exercise routine. Yeah, teach people how to think about supplements, how to think about their sleep. So diet is a big part of it, but it's not the only part.
Okay. So, can we say that it's exercises, it's a sleep, it's a stress factor that also
Yes. It's a comprehensive diet and self-care routine that I educate people what they can do so they can begin step by step implementing these concepts. And while I encourage people to start with the diet, for some that's too hard, and so they start first with stress reduction in a meditative practice. And what they've taught me is, for some, that's where you have to start, get that under control, and then it becomes easier to steadily improve the quality of your diet. So it really comes down to what what speaks to you as the correct starting point for you and your family.
okay. Doctor, I can see so many people just continually messaging us so many questions here. So, if you don't mind, I'll just keep taking a
Yeah.
few questions of yours. So, I can see this is one of the mostly asked question, which is about the vitamins that you can take on daily basis. And someone has asked about vitamin C specifically as well.
Oh, okay. So there's a huge desire to think that a vitamin will fix us. It's really diet and lifestyle. Things that I care most passionately about is, what is your vitamin D level? Are you taking essential fatty acids? And for some, additional vitamin C may be beneficial,
Okay.
but far more important is your diet and your self-care routine.
Okay. And doctor, what do you think about flaxseed oil? So,
So that has the essential fatty acid, the omega-3 fatty acid, alpha linoleic acid. However, my brain and my body will have to add 2 more carbons to that chain. And we're not very good at that. So we need 20 times the amount of flaxseed oil compared to fish oil to make the necessary fats that our brain needs. So if you're a vegetarian, yes, you can do this, but you're going to have much more flax oil than if you had simply taken a fish oil.
Okay. Someone is asking about, can you please advise something about primary progressive MS?
Our protocol, we have published peer-reviewed research that our protocol has been helpful for others with primary progressive MS, leading to significant improvement in their walking, their hand function, their quality of life. And so absolutely, this is, we are one of the few studies with primary progressive MS with published results showing improvement. And if you go to my website, terrywahls.com/research papers, you can get access to the papers and the gait videos showing some of the remarkable transformations in walking for those primary progressive patients.
Okay, so yeah, someone has written that, hello doctor, what kind of diet we should follow? I suggest, as doctor said, you can go to her website and you can also buy her book, the Wahls Protocol, and you can see what kind of diet you can follow along with the other lifestyle measures.
Yes.
Someone has written about DMTs. So I can see 2 questions. One person has written that the person is taking DMT for last 10 years but still has side effects. And the other person has written that since you follow the diet protocol, are you against the use of DMTs?
So DMTs may be appropriate if you're having relapses, continue to enhance lesions. So I'm not opposed to them. A really important question is, when can people safely come off the DMTs? And we're in the process of designing a study to answer that question. In my clinical practice, what I do is I help people implement the Wahls Protocol, get control of their disease. We want to be sure there's no relapses, no enhancing lesions. And then we have a discussion. Do you have to do that for a year, 2 years? We don't know what the correct time period is. And then we began the process of transitioning off DMTs. So we have been successful at getting people successfully off their DMTs. And what I really want to say is we're transitioning them from a drug-only DMT to drug lifestyle DMT, which is a very potent DMT lifestyle, so that we can wean away the drug DMT. And then I stress that your self-care and diet is now your DMT. So if you have cheat meals, you're stopping your DMT and expect a relapse, a rebound, and bad things will happen. So you need to be committed that you can do diet and lifestyle with the same vigor and confidence that you would use for a drug-based DMT.
So doctor, personally, so have you never had any cheat meals ever since?
Oh, so very, very clear. If I have gluten, dairy, or eggs, my trigeminal neuralgia turns on. If I am accidentally exposed to gluten, dairy, or eggs, my face pain turns on. I have the zingers. I carry some prednisone with me, and I'll take the prednisone to turn them off. So interestingly enough, I now think of my face pain, which I'd suffered immensely for 27 years with that, as this wonderful biosensor that tells me how happy my brain is, how happy my microglia are, and am I creating a healing environment in my brain or an inflammatory, destructive one? So it's become incredibly helpful. And so I will never voluntarily have a cheat meal because of the intense, painful consequence if I did.
Okay, and how many hours would you recommend that a person should exercise on a daily basis?
Well, what I want people to do is do mild to moderate exercise intensity for your level of function. So for some people, that is going to be just 5 minutes of walking to the mailbox and back, or 5 minutes of gentle yoga, Pilates. And for others, it may be an hour. But you want to have mild to moderate intensity, sufficient time to recover from that, so you could continue to do the rest of your daily life and continue to work well normally. That is the correct amount.
Thank you, doctor. I can see a question about medical cannabis. What is your opinion about it?
You know, there's some interesting studies that cannabis has helped people with pain, with spasticity, and so if those are issues for you, by all, and it's a legal option in your community, by all means, talk to your neurology specialist about whether or not that would be helpful for you.
Okay, okay. Doctor, okay, I can see, some questions about COVID vaccines, if you don't mind.
Okay. Yeah, so there's a robust literature about COVID as the infection being associated with relapse, with prolonged fatigue, and activation of autoimmune processes. So getting the infection, very serious health consequences and potential long-term consequences. Taking the vaccine, there are a couple case reports of a demyelinating illness such as Guillain-Barré, but keep in mind, we've had millions and millions of people get that vaccine. And so even just a spontaneous occurrence of a demyelinating event following vaccination may have just been a spontaneous event, or it may have been related to the vaccine. Statistically speaking, the infection has a much greater health risk than the vaccine. However, I want everyone, to think about your own personal experience with vaccines, your health status, and make your own decision. But the science, I think, is pretty clear that the risk of getting the COVID for a risk of severe relapse, a rebound of your autoimmune problem, and a risk of developing long hauler is substantial.
Okay. Someone has asked that, have you taken the COVID vaccine?
Have I taken the COVID vaccine? Yes. My son got married this summer. I wasn't going to miss his wedding. We were going to have 170 people there. So I made sure that I had the vaccine so I could feel safe. Plus, my son wanted to have a safe event, and he asked people to be vaccinated plus have a negative test to attend the wedding. He said, Mom, that does include you. I said, yes, don't worry. I'm vaccinated. I have a negative.
That's very thoughtful for him, by the way, because he wants his safety and others' safety as well.
Yes, yes.
Congratulations. And congratulations for your son, doctor.
It was such a joyous time. It was such a joyous time. Unfortunately, we really love the young woman that he chose as his wife, so that also helps. She's a wonderful, wonderful young woman.
Oh, she has to be. She's going to be a part of your family, so of course. So, Dr. my other question to you is about, so we know there are for certain triggers when it comes to MS. So causes, we can say. We say that diet can be one causes, poor diet, it can be because of toxins in the environment and so many. What, according to you, is the biggest trigger that people do not pay attention to?
So there's several things that need to happen. There are about 200 to 300 genes that have been identified as important risk factors for developing MS and autoimmunity. Then you probably, that's step number one. Step number two is an infection. And there are 16 different viruses and microbes that are identified as infections. And then step number three is, quote, unknown environmental factors. Now, from my perspective, those unknown environmental factors are the foods you've eaten, the microbes living in your gut, your stress level, your adverse childhood events, your current adult stress events, your exercise routines, sleep routines, your family relationships. So you can't do anything about the past or your genes, but you can do a lot about your choices today and the future.
Thank you, doctor. Doctor, okay, before we proceed, I have to just say we have around, you can say 15 minutes more to go. We have been talking for around 20 minutes, so just 15 minutes more. So if you guys have more questions, you can of course put it in, and we are trying to address as many questions as we can here. We have a question here saying by the person who's saying, Doctor, does Wahls protocol also help with weight loss? I've tried everything, but nothing has worked for me.
So yes, we find in our clinical trials that people who are overweight and obese lose weight and get back to a healthy body weight. That's very common. And I also, people who are underweight, we've not had problems with them becoming further underweight.
Okay. I have a question by Ritika saying, hi doctor, I was diagnosed with CIS 8 months back.
Yes.
I am back to normal and active now. My last MRI showed a small net dot. Is there a chance that I will get next relapse and change my MS type?
So absolutely, if you have optic neuritis or clinically isolated syndrome, there's a 50% risk of developing a second lesion and then having relapsing remitting MS. What I do in my clinical practices, I put those people on the Wahls protocol to prevent and stop further autoimmune processes, and we've had tremendous success with that.
Okay. I have a question from Angie saying, have you heard that previous head trauma can trigger multiple sclerosis?
Well, as a matter of fact, people may or may not know, I am an athlete. I did full contact free fighting in Taekwondo. So I had multiple head concussions prior to entering medical school. And I had some sports concussions as an athlete in high school. Were those a factor for me? Yes, quite possibly. And having a traumatic brain injury or concussion does increase the risk of MS, of Parkinson's, of ALS, and of cognitive decline, Alzheimer's, also of anxiety and other mental health issues as well. I use these principles in the traumatic brain injury clinic with great success with helping those veterans reduce their symptoms related to post-concussion.
Okay, thank you, doctor. I'm getting a lot of questions asking about stem cells HSCT. So what is your opinion about HSCT treatment?
So right now, that is an approved treatment for people who have aggressive MS that has not responded to very high potent disease-modifying therapies. However, if you do stem cell transplant and do not address the diet and lifestyle factors, what you get is a temporary reduction in the autoimmune process, and you may get very significant improvement of function. So for some people, yes, this is very, very helpful. However, the long-term follow-up studies show increased rates of other autoimmune diseases and an eventual recurrence of central nervous system disease. So if you decide to go down the stem cell route, I would look for a practitioner who can assist with addressing all of the environmental factors to reduce the likelihood of another autoimmune disease process or a recurrence of your central nervous system.
Okay. Doctor, the one other thing which people talk about a lot is the mold exposure. So what do you think is the relationship between that and MS?
So for some people, molds are not as readily cleared. And then if you add in other toxins, other infections, you're going to be more vulnerable. Again, in my clinical practice, the exposures to water damaged buildings is something that we do investigate and consider.
Okay. Doctor, there's one kind of treatment that people talk about nowadays is fasting, a method to improve them.
Yeah, so let's talk about fasting. That's the concept of a hormetic stress, mild to moderate stress, followed by a recovery period. And our ancestors, for millions of generations, had to work incredibly hard to get food. So and then we had our food. We could eat well for a couple days, and then we're back to no food. So our evolution had intermittent fasting, periodic fast as part of daily life. I think it's incredibly damaging to graze all of the time. and not have any period of absence foods. However, clinical trials have shown that patients struggle greatly to do intermittent fasting, to do periodic fasts, and that time-restricted feeding is easy for people to sustain long-term. The benefits of fasting are that it increases your stem cells in your circulation. And so the earlier question, let's do a stem cell transplant. So when people ask me that question in my practice, I say, let's grow your own stem cells. Let's talk about a fasting strategy so you could rejuvenate your stem cells all over your body. And so I have some folks say, oh, that's too hard. I have others say, okay, bring it on, let's do it.
Okay. Doctor, I have one interesting question here. Frank G is asking, do you want to make an updated Wahls protocol, or is the science pretty much settled?
Well, you know, what I've done is I've created an online course that has the updated science and 7 weeks of coaching where I can review what we're doing, what I'm learning. And so if people want to investigate that for my latest thinking, that's at terrywahls.com/aim. We've put, you know, many hundreds of people through that. And that has been extremely helpful. And in that course, we teach people how to do the diet as a vegetarian, a vegan, as a meat eater, or as a ketogenic eater. You know, and actually during the coaching calls, we end up, you know, answering people's questions about answering questions about how to implement the latest research.
I have one more interesting question here, that how long should I fast to regenerate my stem cells?
Okay, so in the animal world, we do the equivalent of a 7-day fast. And so that works well for mice, works well for rats. In my clinical practice, I have people start with time-restricted feeding, be sure they can tolerate that. Then we go to intermittent fasting, which is reduced calories every other day. Be sure they can tolerate that. Then we discuss, do they want to try a 24-hour fast? And they tolerate that or not. When that is comfortable, then we can try a 2-day fast. When that is comfortable, we can go further. My advice in my clinical practice is take your time easing into these fasting strategies so that you and your family can have success. If you try to do a 1-day or 3-day fast straight up, it is usually a huge struggle and people are not very successful.
So doctor, when you say that it's 2-day or 3-day fast, what can they have in 2-3 days? Is it only liquids like water and juice or something, or not even that?
So in my clinical practice, we discuss whether we're doing a water fast or if we're doing a more of an intermittent calorie restriction, and they're having bone broth and vegetable broths during that time period. So that's a conversation I have with the person looking at their clinical circumstances.
Okay. I have a personal question here by Say MS. She says, I got in a car accident and they did a CAT scan, which something came up which showed 12/5 plaque spot in my white matter. Not diagnosed with anything yet. Can you just advise me on something?
So, you know, the comments there, many people have a autoimmune process, whether it is MS or related to another autoimmune disease, such as inflammatory bowel disease, rheumatoid arthritis, systemic lupus. Or they may have chronic fatigue, some low-level antibodies, and no specific diagnosis. Mm-hmm. That is a circumstance where you have excess autoimmune activity, excess innate immune activity. And so all of those concepts that I teach are perfect for that person. So they can begin to turn off their innate immune system. get the immune system to function more appropriately, and begin healing the damage, and never get a diagnosis. So people may call me and say, like, I have a diagnosis, what do I do? And I'm like, oh my God, what you do is the Wahls Protocol, so you don't have to get a diagnosis. Because the earlier we can get you to address these root causes, the more likely it is that you can fully stop the damage and fully regress it, and you have much greater potential to get all the way back to normal. Once you have extensive damage, then it is far more difficult. You're asking a lot more of your body to stop the processes. It's a lot more work to repair. You know, it's sort of like your house. If I have a little windstorm that came by, and I have just a small branch that came down and took off a couple shingles off my roof, it's going to be a simple matter to go up and repair those 2 or 3 shingles than it is if the big tree came down and broke into my house, has water damage, and now it's going to be many thousands and thousands of dollars to repair. So the sooner you stop the damage and let your cells begin to repair, it's just such an easier task.
Absolutely. Doctor, we are almost approaching time, just 1 minute left. If you don't mind, I'll just take last 2 questions here. I'm flooded with questions, but I know we have a restriction of time, so I'll just take a last few, the things we have not addressed before. So one question is about health anxiety. Someone has written, I have very bad case of health anxiety. Do you have any advice for me?
So our program has been really very helpful for anxiety and depression. So implement the diet and the lifestyle. I would also be sure to stress a stress-reducing practice of choice, whether it is meditation, mindfulness, heart math.
Absolutely. The other question I can see here is, Doctor, what are the absolute highest number of lesions that one can get?
You know, I have no idea. Would have to ask a neurologist. So really terrible things can happen to a brain when the autoimmune processes are not controlled.
All right. Okay. Thank you, doctor, so much for your time and giving us so many advices and suggestions to us. I'm still so much flooded with questions, but we can take this another time. And I will be sharing the details of doctor's website, the program she mentioned, and the book where you can go and purchase after the session. So you have to just click and go to the respective sites. And doctor, thank you so much for all your inspiration and all the work you and suggestions that you have given us today. Thank you so much.
Thank you, Ritu.
Thank you so much, doctor. Have a good day. Thank you. Thank you so much, everyone, for joining us today. It was an incredible session with Dr. Wahls. She is truly amazing. And as I said, I will be sharing the details of her website, from where you can buy the book, her research that she has done, and the program that you can follow. And trust me, if you really want to halt the progression of your disease, try the Wahls Protocol. She is the best, and she will help you in every way. And she has herself reversed her MS after being 7 years on wheelchair. So why not just go ahead and try it out? She has been on TMTs earlier, nothing suited her, and then she managed and controlled her MS herself in her way when the medical world was against such researches. So Dr. Wahls is just incredible. I'm going to share all the details with you after the session on our story. So stay tuned, and we'll be coming up with more sessions like this later. So once again, thank you, Dr. Wahls, for all the inspiration today. And thank you, everyone, for being such a great audience. Thank you. Have a lovely evening and happy weekend. Bye-bye.